Thank you very much for this thrilling introduction, which shows that gender issues are of big importance in autism and that question us about how these perspectives eventually evolve. And obviously the best way to study this and to see if the hypotheses that are offered by the literature fit with what we see in clinical practice, a longitudinal study would have been preferable, but what we have done is we've done 3 cross-sectional studies, and the first one, which was done especially by Oosterling and was summed up in a thesis earlier this year, refers to very young children. So what we're going to do is we're going to see if the hypotheses that Patricia van Wijngaarden just elaborated are actually present in the clinical groups. So typically when you think of very young children and toddlers, the referral patterns for boys and girls are very different. Disruptive boys are often referred to toddler clinics, whereas shy and withdrawn girls are far less often referred. But the study we did is based on a project, the Diana project, the Diagnosis and Early Intervention of Autism in the Netherlands, and it's a study in which we go to the well-to-be baby clinics where 89% of all the babies and young children are seen in our country. And what we did was that the teams in these well-to-do clinics were trained. They were trained to become more aware and sensitive to early signs of autism. And early signs of autism are obviously not those coined into DSM, but early signs of autism refer more to lack of joint attention, paying less attention to people than to objects, eye gaze monitoring and things like that. And when they were screened positive at the community pediatrics, they got a home visit, and during the home visit an instrument, the ESAT, with 14 items, which is holds the middle between an interview and a direct observation, was conducted. About 4 in 5 then qualified to be assessed at the university hospital, where we did the ADI, the ADOS, the Mullen to control for their developmental skills, and then they were referred back to the community and got the early intervention programs. So it is interesting that the data that I'm going to present are population-based and recruited over a period of 3 years. And what we saw was 238 referrals, obviously many more boys than girls. And when you look at the reference pattern, the referral patterns, you see that the early screening was obviously the highest referral pattern, but that many infants that were in care elsewhere, in pediatrics or in ear, nose and throat clinics, there too the awareness was raised and they were referred. In 87%, in 32% of the cases, we did not find ASD. So even in the screening, you see that about 1/3 is screen negative when you really do the assessment. So you have 1/3 of false positives, which is a matter of concern. But when you look at the type of problems they display, it are very most of them, half of the false positives had severe language developmental problems, so there were absolutely big issues in their development. attachment problems, regulation problems, and some internalizing and externalizing behaviors. When you go into the diagnoses that were posed in the autism spectrum, we have a very remarkable difference between what was suggested from the literature just before and what we found, not in terms of the ratio, because it's about 1/5, 4/5, so about one girl for four boys, but the big difference is in the diagnosis. At a young age, we see far more girls with a severe autistic disorder as compared to girls with a milder variation within the autism spectrum. And that is contradictory to what we were just suggesting, that women, girls are overlooked because they have milder diagnoses. In the very young children, it's just the contrary. The girls you see before the age of 3 are mostly girls with severe autism. Another way of looking at it are the ESAT, so the scores on the observation, the ESAT completion at the home visits. And what is remarkable is that most of the children are seen before their second birthday, but in many cases there's kind of a parent's delay and they are assessed far later. Parents need time to accommodate to the idea that their children are at threat for a severe developmental disorder. But remarkable is that there's a difference in referral age for the girls that are referred earlier than the boys. This is especially remarkable because in our infant clinic there's a tremendous overrepresentation of boys with regulation problems. So when you go into the niche of autism, then it's remarkable that here the girls are referred much more early. So when autism hits girls at an early age, I think you can say they have a far more severe form of autism than the boys we see. But on the ESAT scores, there were no significant differences on the sum scores. And when you look at the ADOS results, then again, you're surprised by the fact that even in these very badly impaired girls at a very young age, their scores on impaired reciprocity and communication are better, relatively speaking, than in boys, and they show more pretend play. So here we see one of those misleading things that these girls, because they do have somewhere remainders of social reciprocity and communication skills more than boys, and pretend play could be overlooked. But it's very striking that at this young age, these girls have significantly less language and speech. So on these measures, they're very different to the boys we see at a very young age, and they have far lower IQs as measured on the Mullen. And when you look at the symptoms on the CBCL, you see that they have far more higher scores within the factor withdrawn and far lower scores in the factor externalizing disorders. When we look at the families and we compare psychopathology in parents, social stress in the families, one of the striking things, and that is something you have to bear in mind, it's a replication of something we found way back in 1992, that social stress in families with children with autistic spectrum disorder is not higher in the first years of life than in controls. So you can't say that social stress is something that contributes to the development of autism, but we will see in the samples of the childhood, adolescence, and eventually in adulthood, that then the social stress is much bigger. So the social stress can never be seen as one of the complicating factors in the emergence of autism. No, the social stress in families is absolutely the consequence of having a handicapped child. So when we wrap up our data on our infant and toddler study, we can point to some strengths, but we also have to take into account some limitations. One of the strengths, of course, is it's a population-based study. And another strength is that the data were collected in a prospective and systematic way. What is striking is that oftentimes psychologists and medics tend to think that screening is a very effective way of raising awareness. But oftentimes the positive screening is not in pace with the process the parents are going through, and that oftentimes when you screen positive and you confront parents, especially if it's their oldest child, they'll be inclined to be reluctant to accept a referral because they don't know by comparison how typical children develop. They're often told by their grandparents, don't worry, you were slow in developing, you were slow at talking. So screening is not magic. It doesn't mean that you really can get out the cases at a very young age. When we look at the results with all these strengths and limitations, we see that the gender distribution is in line with what we could have expected, that indeed at a young age girls tend to have lower IQs. They are obviously more severely affected and have less communicative skills than expected, as we saw that they were significantly lower on language development than the boys. But the emerging fact is that these girls, despite their very severe handicaps, tend to have more pretend play, tend to have somewhat more social interaction skills, and are far less disruptive, which often causes delays in the referral patterns. So to sum up, I think that in very young girls, the ones we diagnose are somewhat different to the ones that we'll see at later age. They're more effective, but we see in filigram that there are tendencies to overlook problems in young girls. I think, and it's interesting because we're doing the follow-up now, that in the girls with language developmental delays, you see that the ASD diagnosis emerges in childhood. So at a very young age, they're misdiagnosed as only language impaired because of relatively remaining social skills, and they tend to be better in pretend play and social interaction, and then they are overlooked. So that's what I wanted to tell you about the toddlers, and then I'll give you some insight on what we see in children and adolescents. But I'll just get myself a little sip of water.